Let's talk a little bit about the timeline for reconstruction after a diagnosis of breast cancer. Time after a diagnosis of breast cancer can be really hectic and really challenging and really stressful. There's a lot that is going on at one time, and many of these things overlap. So often, what happens, this starts with an abnormal mammogram, which will then lead to a biopsy. And once you get a result from a biopsy that shows that you have breast cancer, things take off from there. First, most likely, you will be referred to a breast surgeon, who is the type of surgeon that will offer you either a lumpectomy or a mastectomy to surgically treat your breast cancer. At the same time, you may also be referred to a medical oncologist. And that medical oncologist, in coordination with your surgical oncologist, will make a decision about chemotherapy. Sometimes some women will have chemotherapy before surgery. Sometimes some women will have chemotherapy after surgery, and some women won't need any chemotherapy at all. Into all of this, we often throw in the reconstructive consultation because if you're going to need a mastectomy, this is the time to meet with a plastic surgeon and start talking about all these things. All this to say is that it's quite hectic. There's a lot of information and there's a lot of fear, there's a lot of anxiety. And so keep in mind that it may be hard to retain all the information you need to come up with a well thought out plan for yourself.